Good morning. My name is ANASTASIUS from EURESCOM. I am the coordinator of this project, which is also one of the phase 2 projects of the FI-PPP that is targeting the health sector as the application domain. One of the reasons why we actually chose to investigate the application of this new technology in the health sector is really related to the very, very high impact that it has on society. Here in this introduction here, I would like to share with you some of the trends in healthcare that can be observed. One is very directly related to the cost of healthcare. These are figures from 2009. Now, today, they're not likely to be very different. But as you can see here, the spending in the OECD countries on health has been increasing by 4% annually, while at the same time the GDP has been only growing by 1.6%, which means that this model is basically not sustainable. So the costs are running extremely high, and basically in a couple of years we as societies might not be able to afford anymore the healthcare system as we actually know it, at least in the industrial countries. Another trend that is being observed or can be observed and relates to some extent to this increased cost in this domain is that we observe that there are many more patients today are treated in their homes, in the general practitioners' practices, nursing homes, and so on, basically outside the hospitals, which is in fact a sort of an indication that there is a virtualization of care taking place. So from the 20th century, back only a few decades or years, where most of the care has been provided by hospitals or by large organizations providing this care. Today we are moving into a system which is very decentralized, meaning that there is a very high need to also organize this provisioning of care over the internet, in fact, and providing these capabilities to actually do that in the long term. Now, FISTAR, as I mentioned, is one of these phase 2 projects that is now preparing its support for the phase 3 projects of this program, of this FI-PPP. So trying to put down what in fact FISTAR is, this is in fact a list of bullet points that everybody can read, and probably you have read this in other occasions as well. What I think is more important here is that due to the very heterogeneous legislation around privacy and data protection in Europe, and the lack yet of a European framework for the data protection in this area, we have the problem that all of the customers, in fact, in this area, basically refuse to push data into the cloud. Now, if we deploy or use a platform which is directly following the model that the program is proposing through FIWare to have everything basically somewhere in the cloud, this was basically rejected by all these customers, so the hospitals and the other people that we are working with, in fact, in FISTAR. So what we have now is a situation where we try to reverse, if you like, or to make a paradigm shift in this area by saying we would like to still use the technology, to still use the advantages of virtualization of resources and the elasticity that we gain from the concepts, but instead of moving the data into the cloud, we would rather like to move the software to the data. So the software that enables us to gain, to achieve gains in the elasticity and virtualization, to move this software into the data. So effectively what we get now is we get a platform instance, according to the terminology in the FI-PPP, that is deployable at any location which the customer chooses. Obviously, there are certain infrastructure requirements that have been fulfilled in terms of how much computing capacity or networking facilities are existing in place in these locations, but the concept is basically tuned towards that. Certainly, we have also some, we call them, of course, staging installations of the platform that can be used really over the internet and are basically somewhere in the cloud. But this is not, well, basically this is only for development purposes right now and cannot be used in the trials we are now planning to start in a couple of weeks. Now, among the objectives of the FI-STAR, what I think I would like to point out here is another weakness that we identified in the program, in the beginning of the program. Now this starts to be different. We identified the lack of a good framework for testing and certification. Because I believe this is not the only sector that actually requires that, but if you try to sell certain components that are going into the supply chain or the service chain in this sector, everybody will ask you about certification, about some sort of guarantees that what you advertise as a functionality is actually also being delivered. We believe that this was a kind of an omission in the early stages of the program. Now I understand this has been picked up as a topic through the architecture board, and people are working to provide more solid testing frameworks for the components that will be at least the basic components, the so-called generic enablers in the framework. Now, as a FI-STAR project, we plan to deliver basically all the components that are making up the platform, so the FI-STAR platform as certified software components. I mentioned the trials, and this is a very short description. There are 2 slides about the trials to give you also an understanding of the heterogeneity of the services that are now being trialed inside the project in order to really get the most, let's say, a good opinion about the usability of this technology of the generic enablers and the platform in the different application domains inside this sector. Now, in Spain, for example, in Bilbao, we are working with an organization called Osakidetza, which is developing interactive future internet-based services for people with mental health problems. Now, Osakidetza is an organization that is providing these services through other means today, and they are in fact planning to introduce these services based on future internet concepts gradually into their current operations. In Leeds, in the UK, we are working with a company called Medichem, which is a wholesaler of pharmaceutical products, and they would like to try this technology for a problem that they want to solve, which is the real-time reverse supply chain model to basically be able to do recalls of false delivery of medication to people. So this is, in fact, I was told, a real problem today in many parts of the world, basically. CUP 2000, or CUP 2000 in Bologna, in Italy, is another organization providing health to the region there in Bologna. They are developing healthcare networks to allow healthcare professionals to share data in real time, and also allowing citizens to access the healthcare data anytime and anywhere. So you can see that there is some sort of opening to accessing this data. However, obviously this is regulated according to the Italian laws, and CUP 2000 and the Italian citizens there know what they have to do in order to protect the data, or what they are allowed to do, in fact, for the data. In Norway, in Tromsø, far north in Europe, We are working with the Norwegian Center for Integrated Care and Telemedicine in the area of diabetes patients. There, the objective is to use smartphone-based applications for multi-channeling, allowing for streaming of different data at the same time. So sensor data from the patients that have to basically monitor their sugar level in the blood, plus audio and video channels in cases where they would like to get some feedback from the doctors and so on. In Poland, in Krakow, we are working with the John Paul II Hospital for designing interactive facilities for cancer patients using live monitoring sensors, tablets, cameras, and so on, which is in fact sort of a new, a new application that they would like to, or application suite, in fact, that the colleagues at this hospital would like to implement for improving the treatment of cancer patients. In Romania, in Bucharest, we're working with the University of Medicine and Pharmacy, Carol Davila, which is also a hospital, a university hospital, and there with the cardiology department in order to improve the, again, the monitoring, but especially the secondary prevention programs that, well, these colleagues obviously hope to improve the whole chain after heart operation treatment. Finally, in München, in Germany, we're working again with the Klinikum Rechtsteiser, which is again a university hospital at the Technical University of München, for the implementation of certain functionalities inside the operation theater, in fact, to trace all the equipment and all the assets inside the operation theater to prevent any errors that are done during the operations, for example, things that may have been left inside the body after surgery. So basically a complete observation of all the assets that are inside the operation theater. At the end, this will be also part of a protocol which is certainly always available after the operation. So this is, as you see, this is a very broad range of services that are currently being trialed. All of them have different requirements and also different connectivity requirements to the affected people, so the actual patients. Some of them are basically in a closed environment, like the surgery operating theater. Or other are also using connectivity, even public networks, like the Tromsø use case with the remote monitoring of patients. So there is a wide range of things that this project tries to cover, and through that to validate the applicability of this future internet technology in this area. This is a little bit of a technical view of what or how the platform is basically designed. So obviously we have also connectivity services that are required to connect the different systems, and as I said, some of them obviously go also outside the different domains of the customers. And we base the whole system, as most of the, or all in fact, of the future internet projects of the phase 2, so the use case projects, on the FIWare generic enablers. And we in fact take the approach that we specialize the generic enablers that we use, turning them in fact by definition into specific enablers. So it is not the case that FISTAR in fact produces completely new specific enablers, but they are the generic enablers basically are turned into specific enablers. Now, following the open call that we also had as part of the work plan, we have now a couple of partners that will be working indeed on some new generic enablers. I'm sorry, these are now called specific enablers, which at least are not present in the current catalog of the Weaver catalog, right? So this is something that will come as new. So obviously they will be starting these days, so we are very early still to give information about that. But one thing which looks very interesting, and it's probably not only in the healthcare domain, at least for us, is also is an enabler that we call a geolocation enabler, which allows us to geographically trace certain assets, not only assets but also data, whether these data leave a certain legislation boundary or domain boundary, which can then be matched to the appropriate legislation, allowing or not allowing this. This view here, I don't expect you to fully understand it, but this is just trying to give you an idea that we partition basically the whole architecture in several tiers. The main big box in the middle is, in fact, what is the actual platform, and this is the part that can be, in fact, deployed on any data center, if you like, that fulfills the infrastructure requirements. Obviously, devices that are very close to the customer, to the user, to the patient, are outside the secure zone, right? At least from the point of view of the FISTAR architecture. So this is on the very far left side, so where the consumer basically sits. And so we have introduced a second, let's say, very thin layer, which we call front-end platform, which is taking care of connecting through a secure network connection the devices like sensors and these type of things to the backend. So this is the only place where data that are somehow not controllable inside the domain are using services of the platform that sit outside this secure domain. On the very right side, you see a couple of other domains or zones, we call them, which are services that exist today, and obviously people in this domain need to reuse, like health record systems or databases, which are basically existing systems. There is no meaning to just redo these systems. So we have also the connectivity or the connection to the platform for this type of existing services. Now, there are a couple of results that will be available from FISTAR. I think the only really important thing here is that this platform that we have designed now and implemented and deployed will be available, in fact, as a kind of a, if you like, as a kind of a cookbook. So to tell you how you can, in fact, deploy this platform on your own, in your own data center, if you have this requirement. Now, not everybody will have this requirement, but I believe in some sectors these requirements may be still prominent. We are publishing specifications currently for this platform also through our website. It's actually not live yet, although it says there end of March. But it will be live very soon. I mean, some of the events in the last couple of weeks, like the FIA in Athens, and so I have disrupted a little bit the continuity of the work there. Yes, I think I'll stop here. These are the contacts. Feel free, please, to check out the website, the blog, the YouTube channel, and if you have any questions, direct them, please, to contact@fistar.eu, or, of course, direct to me. And I would be happy to answer any questions for collaboration even.
Thanks, Tassos. Any quick question to Tassos? Please. So if you want to stand up, we don't have a wireless mic.
Can you hear me? Okay, thank you. So in the beginning of your presentation, you mentioned the cloud and that customers are not willing to share data if you're talking about health. And my question is that sorry, thank you. So I'm GAVRAS, and in the beginning you said the cloud and the issue of data protection, that in the healthcare it is difficult to share data, and customers are denying to do so. And my question is that I often see that the end customers, so the patients, are often very willing to share data, while let's say the intermediaries who are in between hospitals and other stakeholders are the ones who are not really willing to share that. And
Well,
what is your view on that?
there are two things here, right? There is the part that is regulated by law, and there is a part which is a voluntary, if you like, part. I believe in most countries in Europe, if not in all countries in Europe, there are data protection laws in place which require an organization, a company, that processes personal data to take certain measures that are basically specified in a legal framework, right? So they have to do that. They have to deny access to outside, right? Now, a normal customer, like a patient, or even, let's say, a normal, he might not even be sick, but just share his, let's say, vital signs, I don't know, with Facebook or something. I know this exists, but this is a voluntary sharing of this data by this individual. And this is not, in fact, directly related to this or covered by this legal framework. Now, as soon as somebody else tries to do something with this data, then this person or this organization again falls under the legal framework. Right? So we have to separate this. And what I mentioned at the beginning, currently we do not have a unified European framework on data protection. Right? This is still in negotiation. And there was a very interesting session yesterday, in fact, which discussed this point. And the representative from Deutsche Telekom, I don't remember his name, Mr. Ulmer, he said that he's expecting that this framework will be adopted this year in 2014. There will be a grace period of 2 years, transition period. So by the end of 2016-17, we hope to have such a unified European framework in place so that at least if we are allowed to share some data, it is done in a uniform way across Europe.
Okay. Thank you, Tassos, for answer and for the presentation.
Thank you very much.